Okay, so this is how you do a general taping of the ankle from an athletic training standpoint for any athletics or anything like that. So first I'm going to introduce the anatomy of the foot because we use landmarks. We're talking about taping. So here we have the tibia, which is on the medial side of the foot, and then we have the fibula on the lateral side of the foot. The medial malleolus is here, which has 4 ligaments. There's the anterior posttibial ligament, the tibio-navicular ligament, the tibial calcaneal ligament, and then the posterior tibio-talar ligament. On the lateral side, we have the anterior talar fibular ligament, the calcaneal fibular ligament, and the post-talar fibular ligament. So the point of taping an ankle in sports is to protect the medial and lateral ligaments from any trauma or anything like that. So the ankle moves in 4 directions and on 2 planes. We have dorsiflexion and plantar flexion, also known as up and down, or inversion and eversion, or left to right. So the taping presents hyperinversion and eversion, as the most common sprains come from inversion sprains. So first, when we get started, we want to make sure our athlete is positioned at a place where their little under their calf muscle is off the table, so we have plenty of room to tape. We also want to make sure the whole time that the athlete is being taped that they bring the foot in a flex position. So first we're going to start with heel and lace pads. So these are good, you put about right here and then on the back of the heel. And these prevent the pre-wrap and tape, whatever the athlete uses, from cutting their skin while running. We don't want them to have to worry about anything else other than their injuries. Some athletes will choose to use spray instead of pre-wrap, but most will use pre-wrap as some are allergic to the spray. So you want to go right under the calf muscle. It differs athlete to athlete how high they want it, but you want to make sure you put down your pre-wrap first, which will prevent the tape from touching the skin, but will also give it something to anchor on. So you want to make sure the whole foot is in pre-wrap, and when we have rolls like this, usually we just pop them out. And then we'll come back up. The pre-wrap is more important than you would think because ripping tape off is not very comfortable. So again, we want to make sure the athlete's foot is flexed the whole time. And then we are going to put, these are just basic ankle or anchor strips. So we'll just put one up there, and then we'll put one down here so that when we bring the tape down, there's something to tape against. So those are our 2 points of reference. So first we're going to start with a stirrup. So the stirrup goes from the medial side to the lateral side, again with the ankle flexed. I usually like to do 3. We'll go 1 down the middle, 1 up here, and then 1 on the posterior side, just to make sure that everything's being covered. These prevent the ankle from inversion and eversion. So there's 1, pat that down, and then we'll go right in front of it. And then 1 on the posterior side as well. So that takes care of the stirrups, and again, that is to prevent excessive inversion and eversion when doing whatever sport the athlete does. So next we're gonna go to a heel lock. So that prevents plantar and dorsiflexion excessively. Again, at a comfortable level, but not excessive. So we're gonna kind of take our angles here. There's two types of ankle locks. You can do a double ankle lock, which is more sturdy, or you can do a single ankle lock, which you'll just do one side at a time, medial and laterally. And that is just for an athlete who doesn't like their taping as tight. So we'll start with the double. So you're gonna kind of anchor yourself down here and just do a quick, ankle lock here. Just as easy as that. And then come down here. Do one, wrap it up. So I'll just do a quick single ankle lock so you can kind of see what happened there. So you're just locking one side in, basically. So we'll come here, and where the lock comes into key is right here. So this is the lock itself. We'll start down here, and the lock just goes right there, and that's it. So that's why doing two is really important, so you have both sides of the ankle. So next we'll have a figure eight, which is kind of more of a last second sturdy aspect to the tape job. So these are pretty easy. Just go here, and you just give it a good go around the foot. Tape there. So one final thing that I like to do with a tape job or any kind of injury prevention, it's also nice to have it looking good once you finish. So any last minute anchoring to make sure nothing falls off. Make sure all the tape is nice. Usually my rule of thumb is I like to cover all the pre-wrap that I lay down, so I know that I covered all aspects of the ankle. So then the athlete can move plantar flexion, dorsiflexion, inversion, eversion at a safe angle.